Welcome back in the part 3 and the final video of history taking for MBBS and Ayush doctor. I am Dr. Kumar Sharma, consultant, pulmonologist and critical care, currently working here at Bhopal. In the part 1 and part 2 we have covered all point up to 6 family history. Then today we will continue our discussion from treatment history point number 7 onwards. So treatment history is very important. The patient has come to us for any complaint. We should always document. We should try to ask that what treatment the patient has received so far for his present illness in number one. Number two, if there is any history of drug allergy or reaction. This point is very important. Rather, we should try to practice or we should practice that first of all ask the drug history or any food allergy if the patient is having and try to write it with the red pen on the front case sheet. That is very important to know because drug allergy, food allergy is very important. We cannot administer a drug the patient is having allergy to that drug because that can lead to anaphylactic reaction and that can lead to anaphylaxis reaction and it becomes serious condition also. Point third is any surgical intervention or history of accident is significant past. If there is any last surgical intervention or there is an accident history in the past, prolonged use of oral contraceptive that can precipitate cardiovascular accident or penicillamine that is used in Wilson disease that can develop nephrotic syndrome or sometimes vitamin C that can also produce oxalate renal stones. Any history of blood transfusion, is there any past history of blood transfusion, frequency, how much frequent that the patient has received, amount and type of blood transfusion, whole blood or packed cells or a particular component of blood, intake of NSAIDs, non-steroid anti-inflammatory drugs that may cause acute gastric erosion or NSAID-induced asthma, and regular use of oral contraceptive, vitamins, laxatives, sedatives, and herbal medicine. This is very important to ask any regular patient is taking any herbal medicine or not because sometimes many herbal medicine have been found like ginkgo biloba, ginseng. They all are taken by the patient without any prescription for their general well-being to increase their energy level, energy booster, and we know that they are available online and also in shop. So they have a the problem is these herbal medicines have a very important interactions with the medications that the patient take. For example, ginkgo biloba, that is the most common herb used. If it is taken with the blood thinners, can cause nosebleed, it can cause CVA, hemorrhagic CVA, it can increase the bleeding tendency and can be fatal sometime to the patient. So we should always ask that the patient is to be taking any herbal medicine or not. Herbal remedies, herbal medicine, because they have a significant drug interaction with the patient's current medical condition. For this, I have made another video on herbal medicine. Then you can go in the description box, check the link, and you can find a beautiful paper, and that was discussed in brief about the adverse effect of Ayurveda and herbal medicine. Now, 8 point is immunization. Was he was immunized properly as per guidelines, and at least self-medication. Patient sometimes takes self-medication, especially like NSAIDs for painkillers, and they most of the time even azithromycin also antibiotic they used to take self without any medical prescription. Then coming to the 8 point, that is psychological history is very important. By the during the history taking, we should observe the mood of the patient, whether the patient is anxious, depressed, the patient is irritable, euphoric, or obsessed, having neuropersonalization, neurosis, depersonalization is present or not. While history taking, we should also observe the mood of the patient and how does it communicate non-verbally. That can give the clue regarding the mood and the psychological status of the patient. Because peptic ulcer, bronchial asthma, irritable bowel syndrome, these are the diseases, they have some relation with the uh, psychomotor history. Sometimes depression, or these are the example of psychosomatic disorders sometimes. Because peptic ulcer, the patient who is in depression, who takes stress is related to the peptic ulcer. Likewise, same stress that precipitates the bronchial asthma. Stress is it is a factor that precipitates bronchial asthma. Irritable bowel syndrome is also associated with psychosomatic disorder. So we should always ask psychological history carefully. Then menstrual obstetric history. This is the must history, especially in women of childbearing age. We should always ask any female whether married or not, widow, even widow, we should, every woman in the childbearing age group or perimenopausal, postmenopausal area, we should always ask this menstrual obstetric. It's very, very important because many medicine, the reason is many medicines they have teratogenic effect, and if you don't ask, we don't ask from the patient last menstrual history, then it is chances that we can give, we can administer, we can prescribe some medicines that can prove damaging to the growing fetus. So it is always very, very important to ask menstrual or obstetric history, especially in the woman of childbearing age, whether she is married or not, whether it is she is widow, that doesn't married, unmarried or widow. So that is not the criteria. Criteria is only women of childbearing age group. We should always ask history of menstrual obstetric history. This is very, very important. We should stress on. What does it include? This includes menarche, age of menarche, duration of periods, whether it is irregular, irregular, quantity of blood loss, what is a heavy period or a scanty sometime. We can assess by the how many number of pads and the passage of clot also sometimes they say. Any history of dysmenorrhea, amenorrhea or other menstrual irregularities and date of last menstrual period. This is very, very important to know and we should always stress this point. Date of last menstrual period we should know and we should document in our case file, in our case record also. And history of menopause if there is menopause, and any history of post-menopausal bleeding. Obstetric history very, very important. How many pregnancies she had, what were the outcome of pregnancies, history of abortions or carried to the term, history of live birth, male and female child, any complication observed during pregnancy like hypertension, gestational diabetes mellitus, mode of delivery, was it vaginal, what is a forceps delivery, was it cesarean delivery, and last childbirth. All these things have important importance during his clinical history taking. Now coming to our last point, occupational history. This is very, very important. We should ask occupational history in detail about the exposure of dust, chemicals, working in high altitude, coal mines or other business affairs to be taken into the account and there should be noted. Details of occupation done so far in timeline, the occupation from year this to this he has done, he has worked here, from next year he has worked here. So that should be with the timeline, the occupation, the job done by the patient. And last job done, the details of last job done and what was the reason for leaving the job, that should be inquired for. So this all sum up about the basics of history taking for the Ayush MBBS doctors and even resident also. So this has covered the points which are very brief and this we should all should know during history taking. And this comes end of our history taking here. But we should always keep remember this pearls in history taking. What are the pearls in history taking? Number one, be sympathetic and show patience. Always try to be on the patient level in all respect. Because patient deserve dignity, we should be very sympathetic and we should show patience. We should try to listen their symptoms, their agony. We should always be very sympathetic to the patient. And while history taking, we should have a full consultation with the patient story, just listening very carefully, both verbal and non-verbal communication, because that's going to give us the clue for the diagnosis. And if there is any barrier for communication, like foreign visitors, difficulty in hearing, vision, dysphagic, aphagic patient, emotional disorder patient, angry or abusive patient, we should look and we should rectify as far as possible. Obtain some important information from relative. In that situation, we can obtain some information from the relative or a caretaker. This is very important. Catch the non-verbal clues like catching breath, flushing, restlessness, or changing the eye contacts are sign of stress. We have discussed that we should always catch a non-verbal clues because that helps us to diagnose some disease condition. And we should be very sensitive and very careful on highly sensitive topic in history taking like drug addiction, eating disorders, marital disharmony, sexual abuse, or any offending behavior. We should be very sensitive and we should always ask this history in a careful manner. Again, as medicine is, the skill of history taking can be obtained and maintained satisfactorily only by practice and repeated practice. So we should have a practice and repeated practice of history taking can improve us as much as practice we do, we can refine our art of history taking by repeated practice. So all the best and remember always that listen to the patient, he is telling you the diagnosis. Here comes the end of our part 3 video of history taking. Hope you have enjoyed the video. You have, I think you have discussed some, you have gained something from the video. If you find this useful, share among your friends, share the doctors who are involved in history taking. And if you have any suggestion, any comments, you can put down in the comment section. If any thing you want, any particular topic you are interested in, just put a comment and we'll try to make a separate simplified video for that. Thank you. Thank you so much.